Are you guys tired of saggy skin around the neck, thighs, and abdomen? Well, this is the best skin tightening system offered. Skin rejuvenation and tightening with minimal downtime. So it's perfect. And we have our expert plastic surgeon, board certified Dr. Katerina Gallus from Restore SD here today to talk to us about it. How are you?
I'm good. Yeah, really glad to be back.
On this hot day.
Oh my gosh, so hot out right now.
On this hot Friday, but we're going to be talking about some good technology. So you are the first and only female plastic surgeon to offer this in San Diego, this treatment, right?
Yes, that's correct. There are only a few people in San Diego that offer the treatment, and I'm the first female to do that. So it's very exciting. I'm really excited about the technology. It combines the heat energy of radio frequency and the plasma cooling energy to get your tissue to the right temperature with minimal damage to surrounding tissue to offer tightening.
Is it like cold plasma?
Yeah, so cold plasma plus the radio frequency.
Okay.
So that's how you maintain the right temperature.
Wow, I love that. Okay, so this technology has kind of evolved over the years.
Correct, yes. So there's a lot of radio frequency devices out there. There's some ultrasonic devices. So there's a lot of tightening devices out there. And the way I try to categorize them is whether they're either external, so something that gets placed on top of you, or something internal, which is a wand or something underneath the skin.
Okay.
This is a wand, it's underneath the skin. I think that's the most effective way of getting your therapy because when you're doing it externally, you're relying on the skin thickness, on how much fat you may or may not have. So the results are a little bit variable or harder to control. And then when you're doing it minimally invasive, so a little bit of internal tightening with that wand going underneath the skin, then you can, direct the heat at the tissue you're trying to get to.
I love that.
So.
Well, and what I think is kind of interesting is it's only one treatment, right, that you can see results. I mean, that's amazing.
Yes, so it's a one-time deal. So there, again, with the external devices, it's usually a series of treatments. And it's minimally invasive. So for example, for the neck, it's all done through a tiny little incision under your chin, a little incision behind your ear on both sides, and then you wear a funny little neck thing, compression, and you're done. As you heal, you'll see some immediate results, and then the results start to continue to improve over 6 months because we're stimulating collagen and getting your skin to really tighten.
Well, and it's local anesthesia, right? Mm-hmm. So that's even better. And then fast recovery, so you don't really have anything that you have to worry about. You just wear that. Do you wear that for a little bit of time, the bandage?
Yeah, as long as you can. So for a couple weeks, at least for 72 hours, and then usually I have people switch to just wearing it at night.
And then people will see results, or it'll just, so it's immediate results and then it'll keep improving.
Correct.
I love that. So, okay, the other thing is it can be combined with liposuction, right?
Correct.
So that's interesting.
So people who have a little bit of fat under here, it's really great for the arms. Everyone always complains about this, but unless you have a lot of excess skin under your arms, nobody wants to do an incision from here to here. So doing liposuction with the Renuvion treatment really tightens and gets, nice defined arms. It's fantastic for that. So all those problem areas that didn't have solutions, the thighs, so you don't want to aggressively, take fat off the thighs and then have loose, saggy skin. So doing that little bit of liposuction with the Renuvion to get some tightening really helps there too. And the tummy for people who are trying to avoid large incisions.
Well, and what's the most common? Is it abdomen? Is it neck? Like, what are you doing more of, would you say?
I think neck is very popular, and then I think arms and thighs. I mean, most women are really concerned about their thighs, and we know that if you just go too crazy with liposuction and you're over 30, you run the risk of having that loose skin, which no one wants. So you don't want to trade one problem for another.
For another, exactly. Well, and tell us, who's a good candidate for this, would you say?
So it's somebody that has a little bit of fat or none, that's okay too. And then has lax skin, like some aging skin, but not too overly damaged. So if you have fine, crepey skin, that can sometimes, this isn't gonna treat that. You'll need some other combination treatment to treat the superficial layer of your skin.
Okay.
But if you just have a little bit of laxity, loose skin, then this is a great treatment for that. And then some fat if you want to do some contouring.
So if people have questions about that, they should probably do a consult with you, obviously.
Absolutely, yes.
To make sure they are a good candidate.
It's a very overwhelming process to try and figure out what you may or may not need or want. And so it's important to come in for a consultation and we can talk about what your goals are, what your expectations are, and then I can help you figure out a plan that meets your needs.
Well, and you're also doing like mommy makeovers a lot too now, right?
Yeah, so we were just talking about the modern mommy makeover. So traditionally it was a breast augmentation and a tummy tuck. And I think as either moms get older and some of them already had augmentation, I'm doing a lot more of implant removal and then either a breast lift or fat transfer in combination with the tummy tuck. So it's just changed a little bit what people are asking for, but it's still kind of a response to I've had kids and it's changed my look and now I have a different lifestyle and I want to regain my body back and also make some tweaks.
Well, and we love it. And we get a lot of feedback from people when you're on the show that it's nice to have a female plastic surgeon. You know, you don't see that a lot. So, I mean, it's getting more popular. Talk to us a little bit about being a female plastic surgeon in this world. How is it?
So it's interesting. There's only about 15% of board certified plastic surgeons are women. So we're definitely in the minority. But 80% of plastic surgery patients are women. So, you know, it kind of makes sense that you're going to seek out a woman. And it's a different approach sometimes in terms of listening and informing your patients and kind of having that two-way conversation about what you may or may not want and, you know, how much the recovery time is and kind of not glossing over things. That's the most common complaint I get from women that had seen other plastic surgeons was they didn't take the time to explain things or glossed over the recovery time. And I get, you know, what an impact that may or may not have on your life as a busy working mom. So making sure that my patients are prepared and educated is super important to me. And I think that's what really helps me connect with my patients.
Well, and you're so honest too. And sometimes maybe they don't need something, right? Mm-hmm. And you give that honest opinion, which I love.
Yes. Yeah. So making sure that people are getting what the best procedure for them is super important.
Okay, so guidelines real quick for those that want to get something done or they're worried maybe about COVID or they want to come in. Talk to us a little bit about the new guidelines. Like what can they expect when they come in now?
So we have been safely open since May and we're following all the COVID precautions. So the staff are all masked. We have patients wash their hands once they enter the exam room. We all wash our hands. We remain masked unless there's another procedure on the face that's happening, in which case we take different precautions. There's a temperature check and a COVID screening for everybody who enters. We don't have a busy waiting area. We have people, you know, come up when there's an exam room ready. So all of those things have really helped, you know, keep our practice running smoothly. For patients I operate on, they get a COVID test pre-operatively.
Wow.
Because we don't want patients having anesthesia if they're maybe asymptomatic and COVID positive. Certainly you don't have surgery if you're sick, but making sure that that's done. So we've got a system to do that, so to test people preoperatively.
Well, it seems like it's a great time right now to do this, to do the research, because you have the time, right?
Yeah, so we've seen a huge bump in interest in plastic surgery procedures, everything from Botox, because people are, you know, looking at their face on Zoom, so they're thinking about fillers or Botox or sun damage, and it's about to be laser season where you can safely laser resurface your skin, to surgery because you're maybe not driving around your kids to all these events and sports, and so you don't need to worry about who's going to drive your kids to school, or you're working from home, and so you can recover safely at home without, you know, taking too much time off.
But you guys do everything full service. I mean, so you can come in for filler, you can get, you know, a facial, you can get a laser treatment, you can get plastic surgery. So you are, you know, fully operating on the spectrum of everything really that you can get done.
Yes, absolutely. Yeah, we love providing all that kind of breadth of experience for everyone because it's all things that my team, which is all female, we like and embrace. We love talking about skincare and the latest treatments, and then obviously I love surgery, so we bring it all.
Well, we love it. All female. We told you it was fierce female entrepreneurs today. So all female practice, we love that. So the best place to find you is restoresdplasticsurgery.com.
Correct, yes.
And then should they contact you directly there for a consult?
Absolutely, yes.
Okay, perfect. Well, we're so excited, you guys. I know I want to get some laser stuff done after the weather changes, I guess.
If it ever really hits fall.
If we ever get into fall, I'm going to get something done. And actually, if you go to the website, she and I have worked together, and I've actually gotten a few things done with her, with my lips, which I loved. The kiss, we did that. We did the coming out of quarantine makeover, and she's fabulous. I love her team. I can't say enough good things about you. So
thanks so much. We love hearing that.
So we love it. So you guys check her out on the website, restoresdplasticsurgery.com. We'll see you guys next time. I hope you guys stay safe this weekend. Stay cool. Don't do anything I wouldn't do. And you'll see Kat again on our TV show and our live show. So thanks for coming in.
Yeah, it's been my pleasure.
Yay. Thanks, guys. Have a great weekend. We'll see you next time when we put our finger on the pulse of San Diego. Bye.
Bye.